Thank you for watching my presentation. This is Tang Fei, a third-year pathology resident at Baylor Scott and White Medical Center. My mentors are Dr. Mohammed, Dr. Rao, and Dr. Yuns. I'm really happy to present our study about inflammatory and prognostic nutrition indexes in early onset colorectal cancer. We have no disclosures to report. In this study, we investigated the inflammatory index and the prognostic nutrition index in early onset colorectal cancer compared to their controls without colorectal cancer at Baylor Scott and White Medical Center. Early onset colorectal cancer is defined as a diagnosis before age of 50, and the incidence of early onset colorectal cancer has been increasingly at an alarming rate, with a rate predicted to be um, increased by more than 140% by 2030 in the United States. Currently, the US MSTF recommended starting screening at the age of 45 years old for individuals at average risk. However, our understanding about early onset colorectal cancer remains limited. There are multiple inflammatory index and prognostic nutrition index. Most of them are calculated from blood count and albumin glucose. Here are the indexes involved in our study, including prognostic nutrition index, neutrophil lymphocyte ratio, lymphocyte monocyte ratio, platelet lymphocyte ratio, neutrophil monocyte ratio, neutrophil albumin ratio, glucose uh, lympho, lymphocyte ratio, systematic immune inflammation index, aggregate index of symptomatic inflammation, and the systematic inflammation response index. Some indexes are related to staging or prognosis in cancers. For example, NLR, PLR, ANR, PNI can be used as markers for the staging in colon cancer, and PNI uh, can be a prognostic marker in colorectal cancers, and GLI is associated with prognosis in renal cell carcinoma. However, there's limited study about this index in early onset colorectal cancer patients. There's one study indicated that SII and GNRI are prognostic factors in early onset colorectal cancer. In our study, we analyzed 28 early onset colorectal cancer cases and their matched controls who had no significant histopathology. For the patients, they were diagnosed by using biopsy or surgical pathology. Their age is less than 50 years old at diagnosis. Their clinical laboratory testing of relevant nutritional markers were within 3 months of diagnosis. Um, Patients with following were excluded from the analysis, including um, concurrent with other cancers, autoimmune disease, sepsis, fever, recent or current radiation, and chemotherapy. All data was transformed to achieve normal distribution. Ampere t-testing, ROC curve plot, AUC calculation, and DeLong testing was used, and the union index was used to define the cutoff value. And we also used the GraphPad data to analyze the data. Here is a feature of our early onset colorectal cancer patients and their controls. In our early onset colorectal cancer patient, there are more white left colon and more macrostatite stable patients. And the inflammatory index and the prognostic nutrition index, the blood count, albumin glucose, uh, were also listed in this table. Further statistical analysis revealed that when comparing between early onset colorectal cancer patients and their controls, there is no significant difference in the white blood cells and their component, and glucose and albumin, or in the inflammatory and prognostic nutrition indexes. The receiver operating characteristic curves and area under the curve were calculated for each index. Interestingly, um, log SII shows an area under the curve of over 0.7, indicating a fair prognosis. The cutoff value for log SII is 2.824 with a sensitivity of 53.5% and a specificity of 90.9%. Other markers have per AUC values. The lung test results indicate there is no statistically significant difference in ROC curve performance between the indexes. In conclusion, there is no significant difference in inflammatory and prognostic nutrition indexes between early onset colorectal cancer and their controls. Most of the markers have no diagnostic value in early onset colorectal cancer, and log SII may have potential value in early onset colorectal cancer. Further study is needed to confirm these findings. This is the end of my presentation. Thank you so much for your attention.